Good afternoon. Today is July 12th, 2024. This is United TV, and it is our wellness webinar time. And Caroline Weber, our head of our diabetes program, and also today we have a guest. She joined us a couple times in the past before. She's also on the board of our program, Dr. Donna Ciaverelli. So we are going to discuss the fall prevention. And before we do that, if you guys would like to introduce yourselves, so we can start with that.
Sure, I'll go first. I'm Caroline Weber. I'm one of the dietitians on staff, and as Kemal said, I help run the diabetes program. So we work on diet management with individualized appointments, and we also put on webinars, monthly support groups as well.
Hi, I'm Dr. Linda Ciaverelli. I'm a podiatrist. I work with Brandywine Podiatry all over Delaware, and very excited to be here today. Fall prevention and diabetes is a very big topic in our clinic. It's something that I talk about a lot with my patients, and I'm really excited to be able to share a little bit about that and some tips and safety practices and other developments around this space.
Well, thank you for joining us, Dr. Ciaverelli. So we can start with the presentation, and we will have some questions at the end.
Okay, so you guys are ready for my PowerPoint?
We are.
Okay, all right, great. Can everyone see my screen?
Yep.
Great. Okay, so as you know, I'm going to be doing a pretty quick overview of diabetes management and talking a little bit about fall prevention as it relates to diabetes. And there's my name on the bottom there, Linda Ciaverelli. At the end, there'll be some contact information for Brandywine Podiatry. You're more than welcome to reach out to them directly if you have more questions, if you're a diabetic, and or if you're not and you have more questions and you want to come see me on Mondays, I'm at our Wilmington office, and on Tuesdays, I'm at our Middletown office. So, okay, so what we're going to be talking about today, a couple of things. We're going to be talking about an overview of diabetes. I'm sure many of you know what diabetes is, but it's always, I think, a great place to start to talk about what even is this diabetes thing. Then we'll be talking about some fall risk factors, like why it specifically interacts with diabetes and what some of those fall prevention strategies are, like ways that you can stay safe for fall prevention for diabetes and really for the larger population. Then, talking about specific things that people with diabetes can do to avoid falling. Touching a little bit on new technologies. That's something that I'm always really interested in, new technologies to avoid that. And then we'll have some time for Q&A for anyone who is on the webinar, or if Kemal or Caroline have any questions for me. Okay, so what is diabetes? I think that this is something that is often, overlooked. We don't always talk about what it is, but basically it's where your body either can't properly use insulin or doesn't produce it at all. So one of the ways that I always explain this is pretty simple. Your body uses food for fuel, but how does that even work? So your body produces glucose. Most of the food you eat turns into glucose, and that has got to get into the cells. Insulin acts like a key, and it opens up the cell so the glucose can go in. So if your insulin isn't working right, or if you don't have any insulin, then what happens is that glucose that your body is making from the food, it just builds up and builds up and builds up. And that's what causes a lot of the problems, that high blood sugar, or you may have heard the term hyperglycemia. So as that high blood sugar sticks around and the glucose can't get into the cells because the key either isn't working or you don't have enough keys, then that's when we can see some problems. So some people may even, not know what the difference is between the different types of diabetes. And so in the most basic form, for a type 1 diabetic, your body does not produce these insulin keys. So there's no keys to open the door to let the glucose into the cell. There's no way for it to get in there. That's pretty simple, right? With type 2 diabetes, for some reason, the key is not working. And there's a lot of different reasons why that key isn't working. And, there's many different medications. We're not going to be talking about that today, but by and large, that's the overview. And then gestational diabetes is diabetes that develops during pregnancy, and it can sometimes go away or sometimes it stays. Just a little overview so that when we're talking about other things, most people can understand what we're talking about. Okay, so diabetes has a lot of impacts on your balance. One of the ways that we see that is through what happens. One of the things that can happen is something called neuropathy. Now, that's a term that many people have heard either from their doctor or even from commercials. You might see like commercials of people who have like burning feet, or I think there's one where there's walking on something hot. So, and that I think it's really interesting that a lot of the neuropathy commercials, or the way people understand neuropathy, has to do with pain. But actually, what happens with neuropathy is, remember that high glucose that you have? That high glucose can actually damage your nerves. So some people have pain, but some people don't feel anything at all. And that's that numbness and tingling. So that's the piece, that nerve damage. If your nerves aren't working properly, it really can affect your balance, your gait, and it definitely increases your fall risks. So there's a couple of other things. And as a podiatrist, that's obviously the one that I'm going to talk about most. Now, there's other things that can happen with diabetes. Another term that you may have heard is called retinopathy. So, and what that is it's damage to the back of the eye. So as the eye is damaged from, again, that super high blood sugar in the bloodstream, you can get poor vision. Other things that can happen are muscle weakness, and then of course, foot problems. So all of these are risk factors that are specifically associated with diabetes. Now, also seen is with the normal aging process. We start to lose vision, we start to have muscle weakness, and we also can have foot and balance problems. So again, we're focusing primarily on diabetes today, but this is definitely something that people, as they age, it's very normal, and we can talk about some ways to stay safe. Okay, so some pretty simple fall prevention strategies are as follows. One of the things that I talk to my patients about all the time is take a walk through your house and look at it almost like a game. What are the things that could potentially trip me up? Get your grandkids involved. Get them to look at, oh, this chair leg sticks out, or this throw rug is slippery, and make a fun game of it and try to identify places. Tripping hazards are a huge thing. I often see patients who come in who have tripped on, oh my gosh, any number, an empty box, a cat, a rug. I'm not saying you should remove your cat. Don't remove your cat. We all love cats. But you really, you want to go through and really look at it from a fresh perspective. And it might be a rug that you really love and you don't want to get rid of. Maybe there's other things that you could do. Maybe you could gift it to a grandchild that's moving into their, first apartment, or maybe it could be turned into some other kind of a bedspread or a wall hanging or something where you can keep it if it's really important to you, but it isn't necessarily there to like trip you up. Another big thing is adequate lighting. As we get older with the poor vision, and especially at nighttime, it's really important to have adequate lighting. So to have lighting on your surfaces. One of the things I tell people is get a nightlight. Get a nightlight for when you need to go to the bathroom. Or if you're feeling unsteady, there's always a bedside commode. And I know people don't always love the idea of that, but it's really one of those places that when we get up at night to relieve ourselves, it's definitely a time when people are more at risk for slipping and falling. Now, I'll take a little moment away and say that, with that diabetes and neuropathy piece where you're not feeling your feet properly, or you might have numbness or tingling or even pain. One of the things that I recommend every single day is that all diabetics are wearing some kind of a shoe or a hard bottom slipper in their house at all times. And that actually really does include those nighttime trips to the restroom. So having a slipper with like a hard bottom right next to your bed, so that if you get out, you can just slip your feet right on in. You've got a night light, you've got a clear path to the restroom, and that helps you stay really safe. Okay, so those are just some practical home safety tips, looking for tripping hazards, making a little bit of a game about it, and then really looking at the lighting piece. Exercise and balance training. So believe it or not, you can be prescribed exercise and balance training by your primary care doctor or your podiatrist or your endocrinologist or your neurologist or many of the other doctors. So if we see people who are coming in and they're really having a tough time with balance, maybe they've had a couple of falls over a period of time, we can prescribe physical therapy that is a wonderful way, and they can really take a look at you. The physical therapist can assess you, can see where your weaknesses are, and help you find strategies to use assistive devices if you need to, like a cane even, or a walker, or maybe hand railings, things like that. And then can also help you regain some of that balance and exercise. One exercise that you can do if you feel safe with it is to find a chair and a safe place and just practice, maybe not lifting up one foot and holding it, but just practice lifting the heel of one foot up, and then maybe lifting the middle of the foot up, and then maybe lifting that foot up, because being able to balance holding onto a chair, having that single foot balance, is a real predictor for safety. So it's something that some people can do. Now, you definitely want to make sure that you talk to your doctor about this before you try this, and you make sure that you're doing it in a safe way. But that's one way that I know, that's one exercise that the physical therapists are definitely going to talk to you about. Okay, now my favorite subject, foot care, regular foot inspections, proper footwear. There are two rules for Dr. Ciaverelli's patients, and all of you know it because I talk about it all the time. Number one, wear shoes all the time. Your feet should never, ever, not inside the house, not on the carpet, not on the beach, not going to get the mail, not for any reason other than if your house is burning down, should you have no covering on the bottom of your feet. And even then, you should probably be wearing shoes. We all should. So wear shoes, wear shoes, wear shoes. And then the second is check your feet. Look at your feet every day. And what you're looking for is you're looking for blisters or sores or anything like that. And definitely call your podiatrist as soon as you see all of that. That's super important, because you may have a problem and it might be worse than you even know. Okay, so we talked a little bit about the fall management. I'm going to touch a little bit about diabetes management. And because having good diabetes management really does decrease your risk or lower your risk of having a fall. So these are things that you've all heard many, many, many times. Blood sugar control. It's about maintaining that stable blood sugar, checking your blood sugar, talking to your doctor if you're seeing spikes in blood sugar, talking to your doctor about different ways if you're like, oh, I really don't want to check my blood sugar. Well, maybe there's another device, or maybe there's other ways that you can talk about these kinds of things. Talk to your provider. That's what they're there for. They want to know. Also, do you need a referral to a nutritionist? Maybe it's been a while. A lot of people come in and they did the nutritionist, it was 10 years ago, and they haven't seen them since then. It might be a great time to think about going to see nutritionists then. Use some of the services, diabetes education services. These are things that, I think something like 8% of diabetics use. It really does make a big difference. They're covered by insurance and really make a big difference. I'm sure Caroline will talk even more about that. Another big piece is the medication management, making sure that you're taking your medicine exactly the way that your doctor prescribes. And, I know a lot of people who are using insulin, it's really complicated and can be very hard. So make sure that you're sticking to the plan. And if you're not sure, reach out to your provider. One of the things, though, we want to think about is there are some medications that can actually affect your balance and coordination. One of the medications that many of my patients are on is a medication called Lyrica, and there's other ones just like that to help with some of these neuropathy symptoms. And for some people, it can make them dizzy or have trouble, especially in the very beginning. Most of the time, they get better, but these are medications. So make sure that when you're taking these medications or changing your medications with your doctor, make sure to ask, hey, is there a risk that do I have a higher fall risk? Is this going to affect the way that I'm walking through my life? Make sure to ask those questions because you want to know ahead of time, just in case there's a time period when you want to have someone else in the home or someone helping you out, or maybe you normally use a cane, but you want to use a walker for those couple of days. Okay. Now, I'm always talking about new technology, and I think Caroline will know and Kemal know that I'm a huge fan of the use of virtual reality. Virtual reality, many of you know, it's you put a headset on and you're off in another world. Believe it or not, there are amazing things happening in this space. One in particular, and there's several companies that are doing this, looking at balance training using virtual reality, and they really make it fun. You're learning about things. It's a game. This is an emerging technology that many people wouldn't think about, but it works really great. Another space where virtual reality is being tested is in patient education, like magic school busing you right inside your body so that you can understand your diabetes better and how to manage it better. And then look other interactive and digital tools that are available for that. Okay, so that's done, all me talking. I'm absolutely open for anyone to have questions. If you want to get in touch with me, Brandywine Podiatry is my practice, the practice where I work. You can reach out to Amber Miller at brandywinepodiatry.com, and there's our social media, and we have some phone numbers there.
Thank you, Dr. Ciaverelli. So after Caroline's part, I have a couple questions, and I do want to bring up one of the new devices that's being used in Europe, and I think now it's going to be available in the United States. So, but after Caroline finishes her part, I will bring that up. Thank you.
You're awesome. So I'm going to share my screen, and you can let me know if you can see it. Can you see it okay?
Yeah.
So just to follow up on everything we just talked about, we're going to go into some nutrition tips to talk about fall prevention, because food actually takes a really important role, not in just managing our diabetes, but also in building strong muscles, strong bones, to make sure that we do have that stability piece for fall prevention. So first is blood sugar control. So we know that blood sugar control, right? The more we maintain stable blood sugar levels, the better our risk is, or the better improved risk score we have for not developing certain conditions like neuropathy and retinopathy, things that impact our visual sight, our feeling, our ability to move in a safe way at times. So allowing our sugars to stay controlled helps prevent those issues, which may increase our risk of falling. Also preventing the occurrence of high and low blood sugar. So there are side effects to having high blood sugar in the moment and low blood sugar, especially where you could lose consciousness, where you could get dizzy, disoriented, and cause a fall. So maintaining adequate blood sugar control is going to be very, very important for first and foremost for fall prevention. But then there are specific food items we do talk about when you're like, how do I maintain that blood sugar control through food intake? So here are just a couple of quick, brief things that we touch on in nutrition counseling that can apply to maintaining our stable blood glucose levels. So we want to include complex carbs more often than simple carbs. So complex carbs being those really high fiber, slow digesting carbs, and then limiting those simple carbs. So simple carbs would be like, for example, like chips, cookies, crackers, things that are quickly digested and turned to sugar. We don't really want to have those in high quantities because they raise our sugar pretty fast. But having more complex carbs like high fiber, whole grains, fruits, those types of things slowly digest in our system, which are great for maintaining stable blood sugar levels. We want to include a protein. That's probably the first thing we talk about when you come in as a newly diagnosed diabetic. We talk about, adding protein to your meals. It slows down the digestion of that carbohydrate, which means our sugars aren't as high of quantities in our bloodstream. We also don't want to skip meals. They're ton of people who do skipping meals throughout the day. For blood sugar management, we don't really recommend that just because you're at risk for low blood sugars and even vice versa, high blood sugars by skipping mealtime. Your body tries to compensate, and we just want to make sure that you have regular intake through the day so that you can maintain those stable levels. Find your fiber. Fiber is the underdog of every nutrient we talk about. It has great properties, not just for blood sugar, but for digestion, heart health. So find your fiber because it's going to slow down your blood sugar rising, just like a protein would. It's slowing down that digestion practice there. And then we have hydration. Of course, staying hydrated, we'll talk about that a little bit more in depth on some future slides. But stay hydrated, it dilutes your bloodstream of extra sugars. So it does help troubleshoot high blood sugars at times. Stay moving. Obviously, moving and exercise helps to reduce overall blood sugar, acting similar to insulin, where it can get that sugar into the cells. So movement is going to be great for lowering your risk for higher blood sugars. And then taking medication as ordered, checking your sugars often, staying ahead of the game, being prepared. And then something we also don't touch on enough, in my opinion, is improved sleep hygiene and stress levels, right? When you don't get enough sleep, your cortisol and stress hormones are higher, which cause your blood sugar to be higher. And there's even studies showing that if you don't get enough sleep, your hunger hormone ghrelin starts to act differently, right? You might notice after a really bad night of sleep that you're craving certain things, maybe higher calorie, higher fat, higher sugar foods. That's for a reason, because your hunger signals are off because your sleep schedule is off. So getting adequate sleep and improving those stress levels can absolutely improve your blood sugar levels. So now we get kind of into the basics of what types of foods are we looking for to help our fall risk decrease. So we have protein, and it's essential for preserving bone and muscle mass, especially as you age, right? We want to make sure that we get a good source of protein, we get a good amount of protein in our diet. Those with decreased protein intake, especially if you're older in age, are more vulnerable to muscle weakness, loss of muscle, being frail, which can increase your risk of falling and increase your risk of serious injury or trauma from the fall. So even if we end up falling, we want to make sure that our bodies are sound. We have strong bones, strong muscles to help recovery if that's needed. You can find your protein sources in dairy, meat, poultry, fish, legumes, tofu, grains, nuts, seeds. Both meat products and vegetarian-based proteins are going to be a great source. So you want to get a very adequate source of protein in your diet. We also have micronutrients that we want to focus on to make sure that we get good and adequate amounts for preventative care. They work together in combination with each other. So calcium and vitamin D are two of the most key players there. Calcium builds, maintains the bone, while vitamin D helps that absorbing calcium efficiently and effectively. So lack of calcium over time, we know, contributes to osteoporosis, bone loss, weaker bones. So we want to make sure we have a good amount. There are, based on the American diet, most people can be low in calcium. Depending on the age, recommendation is like 1,000 to 1,200 milligrams. So talk to your dietitian, talk to your provider about supplementation if your diet isn't full of sources of calcium, which we would find in dairy products, dark leafy greens, vegetables, fish with the bone in it. There's even fortified food and beverages as well. Most of us are low in vitamin D since we're not outside 100% of the time. Sometimes we have trouble absorbing vitamin D from food. So in that case, supplementation might be useful if your vitamin D levels are low. So talk to your provider about that as well. You could find vitamin D in fish, eggs, fortified milk, liver oil, those types of things. Your other nutrients would be iron and B12. So a lack of these nutrients could cause anemia. Biggest thing with this is anemia can lead to some symptoms of like dizziness, fatigue, just increasing your risk of like disorientation. So you could need a supplement if you are low. A lab test would show this to you. You could talk to your provider if you have concerns. But you would find good sources of iron in your dark leafy greens, legumes, red meat, shellfish, eggs. But it is more bioavailable, which means it absorbs better through your meat sources. So if you're really looking to get a good absorption of iron, go for your meat sources, but you can do some dark leafy greens and vegetables for your iron sources. You just have to increase the quantity usually. And then your sources of B12 would be mostly animal product, low-fat beef, fortified cereals, soy milks also have it as well. So just making sure we have a well-rounded diet, but if needed, supplementation can be very effective in these areas once talking to your provider about it. So this one is also something that doesn't really come to mind when you think of fall prevention. But us dietitians love to talk about it because we're all about sustainability and making sure you have sustainable life practices for an overall healthy diet. We want to refrain from chronic dieting. So chronic dieting is defined as the persistent cyclical pattern of restrictive eating practices. So especially if you're kind of cycling through these restrictive diets, you're limiting yourself of essential nutrients. Cutting out a food group or restricting certain things in your diet can lead to bone mass loss, muscle loss, and we don't want to pull from those things because that can increase your risk of falls as well, or a risk of trauma associated with falls, like fractures and bone breaks. So we want to make sure that we are not consistently depleting our body of essential nutrients that we need. And then finally, hydration. A lot of us don't drink enough water as it is, especially in this heat. We want to make sure that we are getting enough water through the day. High blood sugars can lead to dehydration. We find that our blood sugars tend to be higher if we're dehydrated. So dehydration can cause that dizziness, lack of coordination, confusion, which can all increase your risk of falling. So we want to make sure that with the weather change, with exercise, diuretic use, especially some diabetes medications that we're on, they all increase our risk of dehydration. So allowing ourselves to have regular intake of water, replacing with electrolytes if we're heavily sweating, that can absolutely, one, help your blood sugars remain normal and stable, and two, prevent any kind of falls related to dehydration. So just a quick summary of our nutrition points for today is falls are preventable, right? With continued blood sugar monitoring, control, following up with your healthcare team, regular checkups, and eating a balanced diet, well versed in different nutrients, you can absolutely decrease your risk of falls and even decrease your risk of any trauma associated with falls if they do occur. And that was it.
I have a question. Oh,
Sorry, I was on mute. I'm not used to being on mute, so I say this all the time, but I'm not, so that's why I never unmute myself. So thank you for both the presentation, what we went through, and one of the things that I believe I mentioned in our past meetings, but the reason I'm going to repeat it because we do forget some of these. So I just want to put it there as a reminder. When I was as part of the St. Francis Hospital's trauma program, so they were going to go up from I think level 4 to level 2. There were a lot of statistics available at that time, and one of them was kind of always it still amazes me. 50% of the trauma cases are coming from one level falls. So they are not necessarily all like car accidents or big injuries. They are actually from one level fall. And the reason for that is because, especially for our elderlies, the way that everything works in our body changes. So then as brain actually shrinks, there is more space between the brain and the skull. So then any kind of kind of like hit when they fall, it can actually create much more damage than if it was happening to a 25-year-old or 35-year-old. And I lived with a Parkinson's disease patients for 20 months several years ago, and there were a lot of learning at that time. So this was one of them from brain shrinking as we are getting older, and then also the trauma cases being at 50% at one level fall. But because of that, other than what we can do to kind of protect and prevent certain things as we are taking care of our body and working out and doing different things, the nutrition, of course, there are devices that's available. And one of the new ones, Dr. Ciaverelli, of course, Kemal as well, but I want to ask Dr. Ciaverelli specifically, and I'm sorry, I should have brought this up to you before so you could see, but one of my friends, they developed this device. It has a name, it's Larry, device name. So I'm going to actually share my screen so that you guys can see what I'm talking about. So this is a home sensor, and it just works with a simple smartphone. So let me share my screen. Let me know if you guys are able to see. Can you see the screen now?
Yep.
So this is Larry. So Caroline, don't get any ideas. Your mom is so young, so you don't have to check on your mom. However, with the different situation that we go through, we may need to. So, but I can relate to this. I see my mom having some issues, and this is a device that's going to help those to actually monitor what's happening with their loved ones. So it works a little bit differently. So I got one device already in hand, and one of my friends is going to use it. He had some injury, and he lives on one level, so he was willing to try this. So it's very simple, pretty straightforward. And when we look at the product highlights, so indoor activities, in bed hours, time spent indoors, time spent outdoors, bathroom, shower, wake up detection, inactivity detection. So these are kind of like at least communicating with those who may be taking care of those patients or those elderlies. So it's extremely useful. It's going to be a very useful tool, and I wanted us, United Medical ACO, to put some pressure on our insurance companies to see if they can actually cover this, knowing that fall prevention is one of Medicare's focus. Medicare Advantage programs, they are also promoting certain things, and they're actually promoting certain devices like blood pressure machine, and they are sending home test kit for A1Cs. So this can be a lot less costly before someone gets an injury. So, Dr. Ciaverelli, I want to ask you if that would be useful for patients. What's your
So first of all, I love the application of new technology for old problems, and or problems that have been around for a long time. I should probably say it like that. So, these are, I think home monitoring, and in fact, remote patient monitoring is a huge space in healthcare today. We see all kinds of remote monitoring in the podiatry space. There's remote monitoring foot pads to monitor patients remotely who are at risk for foot ulcers. There's a variety of cardiac monitors, heart monitors, blood glucose monitors. Many people know, like the CGM, the continuous glucose monitor. So we're starting to change the way that we monitor patients from just a one-time, go into the doctor every couple months, get blood tests, get a quick snapshot of where you are, versus a more holistic view of all of the things you can do. And I think so that's largely where the remote patient monitoring piece is. This is this is a step further. This is prevention, right? So this is a way, where you can monitor a patient. This is a potential tool, and I'm sure there's many other tools like this that can not only help you identify the risk, but then can give you like actionable things to do. Okay, mom, I see that you're really spending all of your time in bed for these hours. Like, come on, let's go for a walk, or, get a bridge group, or, so really starting to look at that, not just from the monitoring perspective, but from having actionable, steps to take. And then on top of it is that layer of safety. The one thing that I would put forward is that, when we look at these digital tools, one of the things we do have to think about is privacy and security, making sure that anything that we're, and I'm sure that Larry has been very well vetted, and many others have, but making sure that you're being careful about the digital tools that you're using, making sure that your data and all of those things are carefully carefully controlled, because this is more information about you. And so just making sure that those access pieces are, you're going with reputable companies. So I'm here for new technology. I think, obviously that's something that I'm really excited about. I love that. And I do think that from a value-based care perspective, and that I know that's a term that we all know and talk about. I mean, Kemal, you're the master, but for many people who may not be aware, a lot of the conversation in healthcare today is about bringing, like, preventing disease, preventing these complications, preventing these costly and not just costly like from the money side, but the risk. There's a cost, the risk. So whatever we can do to use these new tools to help prevention, I'm all for it, to help prevent these things. So yes, I think insurance companies should definitely cover that.
Great. So the way that we are actually planning to set this up, not just making the device available, but also being able to monitor the signals, and like there's the center. It's almost like our care coordination. If we are able to assign patients to those individuals, then because someone, if let's say, like when you are at work, you may not be able to know everything that's happening. Being able to separate the emergency from non-emergency, and being able to be in touch with those, I thought it would be kind of helpful to have that service in the central office and make it available to those individuals. Because like right now, like if you look at my schedule, I'm in meetings all day long. I want to receive that emergency call. I don't receive any emergency call, but I want that emergency call to be screened. So if there's a service nurse or care coordinator is able to actually take care of that piece, then they can reach out to us when it's an absolute emergency. And I think it's going to be useful. And it's not only for elderly. So a friend of mine who had a surgery last year, and he's still having issues walking and getting around, and until he's fully recovered from it, it would be important for his family to know. And then when I was actually trying to see how we can actually test it here, he can try. And then he said he was willing to do it, and he just received the device today. So we'll see how it's gonna go. But thank you for your input on that. Carolyn, anything else you want to add?
No, nothing on my end. It's just really cool that something like that actually exists.
For your mom, so don't even take it.
Yeah, but I think it's very cool.
So, well, thank you so much. So this is our first episode from the new studio. So hopefully this is going to bring a lot of viewers to us from our patients, so they can benefit from all clinical presentation that we are doing here. Dr. Saranda, I know you are busy with patients and other projects that you have, and we really appreciate for you being part of the discussion and doing the presentation. Thank you so much.